Here in North Carolina, the state health department is reporting 162 cases of monkeypox. The CDC is reporting over 11,000 cases across the U.S. Now, while it may be very scary to think about this, health experts say it is a very treatable thing, especially when caught early.
We have a vaccine and we have therapies that we developed originally against smallpox, since this virus very much is in the category of smallpox, although it is much less severe. So the real challenge now is to expeditiously get those interventions to the people who need them.
All right, so there are still many questions, though, and concerns when it comes to the virus. For today's To Your Wellbeing, we have Dr. Andrew Wallace with the Cone Health Regional Center for Infectious Disease. All right, so let's talk about this. The World Health Organization, they declared monkeypox a global health emergency. So what does that mean? And then, kind of how concerned should we be here in the Triad?
Yeah, so declaring monkeypox a global health emergency was designed to trigger a coordinated international response. It helps free up funds and enable collaboration on sharing vaccines and treatment. I think it was really a call to action for the world community to help stop the spread of the virus. And in order to do so, a coordinated international response is essential. In terms of how concerned we should be, I think it's important to recognize that we are seeing monkeypox in our community. And while the overall risk to the general population is lower, being aware that we are seeing it in North Carolina is important.
And I know you said in our community, so I mean, I know there's 160 something cases in North Carolina, but we are seeing it here in the Triad as well.
Yes, we are. We are seeing it in Guilford County as well.
All right, so with that said, people are going to be concerned, right? And they're going to be concerned about a possible monkeypox pandemic. So kind of talk to us a little bit about that.
I don't think that monkeypox will become a pandemic in the sense that it'll drastically change our daily life like we saw the last couple of years with the COVID-19 pandemic. We know more about this virus that causes monkeypox because it's been around, and we already have a lot of tools to help slow the spread. But the emergence of it is concerning development and could very well keep spreading within the US and around the world. My sense is that we will keep seeing an increase in cases here, both in the US and North Carolina. But I think as public awareness, access to testing, and availability of vaccines increases, then hopefully we'll start to see a slow in the spread as well.
All right, and we use that word as well a lot, right? The spread of it. So let's just talk about it. How does monkeypox spread?
Yeah, it spreads from direct contact with an infectious rash or bodily fluids from respiratory secretions during close physical contact. That includes things like kissing, cuddling, sex, or touching items like clothing or linens that have touched the rash of infectious fluids. Pregnant people can also spread it to the fetus through the placenta.
All right, so I mean, really what perks up most people's ears is when you hear that it can be spread through clothing, especially if it's been on somebody who had it, even if it was just a rash. So if it's spread through clothes, can you get it by trying on clothes in a store?
Although the spread of the virus by doing something, say, such as trying on clothes at a store, is theoretically possible,